talk to me about how dentistry has been. Okay, let's talk about your journey. You first came here to do interviews.
So I actually put out feelers. For me, I put out a lot of feelers. I just wanted to know what it was like out here, because I had heard very mixed reviews about dentistry in the Middle East and how very saturated, which, to be honest, yes, I can agree it is, but it depends what you make of it. Again, I want to put it back to that. Like, life here is what you make it. Simple as that. For me, I had just put out the feelers, and I was actually coming out here to visit family, and it was a case of something had lined up just prior to me coming out. So I was like, okay, well, I'm going to be here at this point. Can we meet then? They said yes. I think I was out here for 10 days? Yeah, 10 days I was out here for. This is how quick Dubai works. The day I landed, I think I got back to my brother-in-law's house at about, 3, 4 in the morning.
Yeah.
Slept for a few hours, had a meeting with him at 10.
Yeah.
And went well.
Yeah.
Went really, really well. Everything was fantastic, alhamdulillah. And got invited back.
Perfect.
A few days later.
Yeah.
And everything went really well again. I felt really, really comfortable. So I had good feeling at that point. And bear in mind, between these two meetings, I actually personally went pretty much door to door to all these other practices to see what their infrastructure was like, what things they did, what offers they had potentially on the table, where they even loved recruiting and things like that. The one thing I found was that until you put feet on the ground here, nothing's going to happen. Nothing. Because previously I had you see all these ads online, recruiting for dentists, blah, blah, blah. Just actually doing that and applying, they ain't going to get nowhere. You physically have to put feet on the ground and actively be ready to put your face in front of people in order to do it, in order to make it work. But after that second, obviously the interview kind of thing, and when I had that conversation with them, again, like I said, I had good vibes. See, by day 10, I had signed a contract and I was on my way home, ready to hand in my notice. Alhamdulillah, it happened very, very fast. And that's what I'm saying, they don't waste time here. If they want something done, like you've just said, they'll get it done. And it's as simple as that. But it was quite a surreal experience, and it was a very quick decision. I remember when I found out, and I was like, saying to my wife, I was like, okay, I've kind of got a job, do you want to move me?
So, how did that conversation go?
She was delighted. Yeah. It's been on the cards, alhamdulillah, for her for a long time. We wanted to do this for a long time, alhamdulillah.
Amazing, mashallah.
Like I say, so I think about doing it with the right intentions, doing it with the intention of hijrah, and making sure that you're doing it with a clean heart. Inshallah, it will be a success.
Of course, man. Of course. There's so much blessing in making decisions for Allah subhanahu wa ta'ala. But yeah, I know what you mean with regards to making sure that this is one of the questions I get a lot is what is dentistry like out here? Now, obviously, I can only answer it to a certain extent, right? From what I've heard from people like yourself who are actually doing dentistry here. But it's very similar to any other industry that people are getting recruited for. If you have to be proactive, right? I think there's a big percentage of dentists, especially in the UK, who are just like too passive. And they just expect the world to come to them. Even in the West, even in the UK, right? If they're trying to get they're looking for a private job or something, and they're like, oh, I can't find anything. And I'll be like, okay, what are you doing to find a good private job? Do you have a really solid CV? Have you had your CV ripped apart by people who, like mentors or dentists or very credible or good private dentists? Have you had people rip apart your CV and give you advice on it? Do you have a really good photographic clinical portfolio, right? Are you putting yourself out there to go to random practices that you think will be a good practice, like a good high-end private practice, and asking them if they're looking to recruit? This is what you have to do if you want to find a good job, right? One of the things that I think my skills, right, is I'm very good at selling myself at a dental interview, right, to principals. Bro, I've only been rejected for one job ever in the 8 years that I've been a dentist, right? And the reason why that is because I'll give you one example, right? The first ever private job I got, I was living in Dewsbury, right? And there was this private practice right next to my apartment, and I'd see it every day when I'd be driving to work. I was working in Leeds, Bradford, Barnsley. And I see this private practice literally 5-minute walk from my house, right? And I'd just be thinking in the back of my mind, oh man, it would be perfect to work there. I wouldn't have to get in my car, no traffic, no commute, just wake up at like 9:15, right? Wake up at 9:15, wash my face, brush your teeth, right? Quick shower and then go, right? And I remember they posted on Facebook one point to their patients, right? To our amazing patients, our current dentist has had to move. So what we're doing is we're closing the book currently, and as soon as we have another dentist, we'll be looking to open up our book again and take on more appointments, right? Immediately, I messaged them and I said, listen, I'm a dentist. I've been qualified 2-3 years. I live very, very close by. Could I come in for an interview? Put myself out there, right? And I had booked the interview, and I think I was one of the first people because did it so quickly, and I got the job, alhamdulillah, right? Yeah. But at that interview, I remember selling the crap out of myself, right? I said, listen, I will do what other dentists won't do. I will talk to your patients like human beings. I will treat them like human beings. I won't treat them like they're on a conveyor belt, which is unfortunately what most patients are on the NHS. If you've got an NHS list, right? I don't know exactly what it's like in Scotland because I only did mostly my NHS was in England, but you'll see like 30, 40 patients a day, right? 10-minute exams if you've got a stable list. There's no way that you can actually talk to your patients long enough for them to feel any kind of rapport has been built in a 10-minute appointment. Yeah. Even a 15-minute appointment, right?
I agree with you. I completely agree with you. I mean, I think that was one of the reasons why I personally left the NHS very early on as well in that respect. I think it was, I felt like the work that I wanted to do for patients, not that it was compromised under the NHS, but you felt rushed almost because it's very difficult to earn a living and support a family if you're really trying to do all the ultra perfect things.
Yeah,
and
of course.
For me, that was where I drew the line to myself. Ethically, you could say, because one of the things that we're always taught is treat patients, put their interests first. How are we putting their interests first by rushing their treatment? We're not. Simple as that, we're not. And so how can you practice ethically if you're just ramming through? That's, for me, that's where I had a feeling that a problem could arise if I was to continue on that path. More so for myself and just my own morals. So I did take the leap, I think much like yourself, very early, and you entered the private field, but you just feel like you've got that little bit of extra time and you can produce something that you want to be superly long lasting and just as perfect as possible. No,
I think it's important, right? Exactly as you've said, right? No, there's no moralizing here, right? Obviously, we've worked in the NHS. We understand that to a certain degree, right? It's not financially viable to be spending 20 minutes on every patient for just recall examinations. It's not financially viable. If you want to make a living, you have to just smash the patients out and see them very quickly, etc. Obviously, doing your best to do high quality treatment and make sure you're not missing anything out. We're not saying that. Obviously, having worked in the NHS, we understand that is necessary. But the point is that if you want to get out of the NHS conveyor belt, you have to put yourself out there. You have to put yourself in uncomfortable situations. You have to do what all the other NHS dentists aren't doing, which is taking good quality photos of all of your best work, is building a really good CV and putting yourself out there and just presenting yourself at practices, even if you don't think they're recruiting. The opportunities are out there when you put yourself in a position, when you are proactive. There's so many amazing opportunities. So I think that is the point for any NHS dentists that are just looking to escape, is you need to be proactive, which is unlike the vast majority of NHS dentists, unfortunately.
I think the other thing as well is, like, correct me if I'm wrong, but I found more enjoyment in my job itself, practicing high quality private dentistry.
Of course, that's a given, man.
And what's your thoughts on, do you think that the NHS system will, I don't want to say collapse, but do you think it'll become more of a core-based system moving forward, or can you see that happening?
I think I used to get the question from patients a lot, the government's trying to privatise the NHS and this and that. I was like, I don't know if they're going to try to fully privatise it, right? All they need to do is they need to continually boil dentists are the frogs, right? You know the boiling frog analogy, right? You put a frog in a boiling pot of water, it'll jump straight out, right?
Yep.
But if you put it in a pot of cold water and you slowly bring it to the boil, it'll acclimatize to the temperature too slowly. And by the time it's realized like it's boiling, it's too late, right? It's done. That is dentists in the NHS, right? So I think all the government need to do is continually make the NHS contract slowly worse and worse, which is exactly what's happening, right?
You hear the stories.
Until it's completely unfeasible for dentists to work in the NHS, and they force dentists to leave and go private. I think that is what's going to happen more. I think more and more practices are going to be forced to implement private, like Denplan or something like that, to actually survive.
Yeah.
Because the government are going to continually make the contract worse and worse until they force the vast majority of dentists out of the NHS, and they're like, oh, no, the NHS has collapsed. It's not our fault, which it obviously is, because they've not been funding it. And that's what's going to happen. Yeah, potentially it'll become a core facility, but yeah.
I just see more and more people back home wanting to shift from their NHS position, and I'm seeing a lot more people pushing for more of a privatised job. And to be honest, I don't know if the whole corporate thing back home has a thing to do with that though. Whether or not that will keep the NHS going almost, because at the end of the day, people are going to need jobs. People are going to have to, some people will just be like, okay, I'll just continue doing it. And I think that's where dentistry gets its bad rep from in the UK, in the sense that people are not happy in their jobs, not satisfied with their jobs because they are working that conveyor belt. And I just wonder sometimes if the corporate ladder does have a say in that, and does have a reason for that to be the way that it is.
I think corporates are definitely contributing to that. I think there's a few different types of dentists. I think all young dentists are going to have to work in the NHS. And I actually recommend that they do.
Build up your skill set.
Exactly, because in the NHS, you're going to get that volume of treatment that you're not going to get privately, right?
Absolutely.
You're going to see hundreds of root canals. You're going to see hundreds of extractions. You're going to do lots of difficult extractions, crowns and all that stuff. Privately, you're not going to get that volume, and it's really important that they do that volume right at the beginning, and they develop a significant competency in all the basics. So I think mostly all the young dentists are going to be doing the NHS, but I think what we're going to increasingly see is the older dentists who get in that kind of comfort zone of doing NHS dentistry, and they just stay in the NHS for the majority of their career. I think we're going to see less of that. I think we're going to see more dentists after about 5 years of the NHS start to leave. And what I'm hoping is more practices start to look into the idea of moving fully privately. I know obviously for a lot of practices, NHS practices or mixed practices, principals see it as a very stressful thing, or a massive risk to convert the practice to fully private. But I've seen a lot of stories of principals who have done that, right? And yes, obviously it's going to be a stressful, risky thing, but I don't think I've seen that many examples of principals who have made that jump with a clear plan and it not being one of the best decisions they've made. Obviously it's going to be stressful. Obviously it's going to come with a huge amount of risk, right? There's going to be ups and downs. There's going to be teething issues. But I can't remember seeing a case, as I said, where they've come at it with a very clear plan and they've not made it a success, and it's not been a really good financial decision.
100%. The other thing I've noticed as well, particularly people our age, or maybe slightly older, slightly younger as well, a lot of them are actually taking their own personal leap to open up a new practice. And I wish them every success. I mean, there's so many people that I can think off the top of my head that are doing it right now. And I think it's amazing. It's quite inspirational almost, because it's like they're taking that hard graft at the earliest point of their career to then hopefully satisfy themselves for later on. And I think it's just a great decision. I think I personally see dentistry moving far more private. I can see it almost being 80% privatised in the long run. If things continue the way they are under the NHS system.
Which they will. There's no chance it's going to improve. I think it's a fool's idea to think that the government are actually going to improve the contract at any point now.
It would be nice. It's nice to think about it potentially that it could be, but yeah, you're right. I don't see it.
The other thing with regards to owning a practice, right? Again, this is another question that I get a lot from associates. They think that once they reach a certain milestone, once they're making like 12, 15k a month, I'm making 12, 15k a month, I think I should open a practice now. I don't think that's always the next logical step. I've talked about this before, but I think being a really good associate, high grossing associate, does not automatically mean you're going to be a good principal. Yeah. Because obviously it requires completely different skills. It requires significant understanding of sales, marketing, and business as a whole, managing employees, managing staff. One thing we don't appreciate as associates, right, is how annoying associates are, right? I've worked in my cousin's practice. He started the practice in Manchester, beautiful private practice in a really, really good area. And obviously, because he's my cousin, we're the same age, we went to uni together in the same year, I know exactly all of the stresses that he's dealing with and how difficult it is managing a private practice.
Yeah.
And honestly, because when he first opened up, he would tell me about, all the stuff that he was dealing with, and associates can be so annoying, right? And one thing I've tried my best, and I think alhamdulillah I'm quite proud of, right, is that I'm a very low maintenance associate, right?
I was just about to ask you, were you one of them?
I think you're the same, right? Like, we have been through certain practices. I've worked in some horrible practices, bro, right? Terrible practices, really badly run, right? I remember I was working in this one practice, and I'm not going to say where. Right? I was working in this one very early on, right? The principals were actually really nice. I really liked them. They were really good guys, right? Two principals. They were really good guys, right? And I looked at them as friends, maybe slightly mentors. But at the interview, they promised me XYZ, you're going to get a really good list, and we're gonna make sure it's easy for you. You're just finishing foundation training, and you're going to get a good nurse, blah, 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 right? Unfortunately, none of that was true. After 4 months of working there, I was making a loss. I've talked about this before, but yeah, I was making a loss. I remember I would be in the middle of a crown prep, right? Uh-huh. And now, you're drilling, and obviously the whole thing's covered in water. So you put the drill down, blow some air on it so you can see the margins. As soon as I put the drill down, the nurse would aspirate, and she'd put the aspirator down, and then she'd leave. And then I'd be like, well, she's probably just going to do instruments or something, right? And then I found that she'd keep doing that, right? And then I'd be ready to start drilling again, and she would be nowhere to be. I couldn't find her, right? And I'd have to get up and leave my practice. Where is she? And I found out she was just going out to chat to reception, or go out and just have a chill somewhere for a few minutes for some reason in between. And I was like, what the heck is going on here? Right? Stuff like that, right? So I've dealt with, some really crappy practices, having to deal with rubbish equipment, broken equipment, right? So alhamdulillah now, right? See, when the high speed is leaking or is like barely working, I'll deal with it. Do you know what I mean? I will not complain. And I think alhamdulillah,
You've had it hard, dude.
I've had it hard, bro. But alhamdulillah, I think that's a major asset that the principals that I have worked with recently really appreciate. They know that, listen, I can give Maz anything and he'll just deal with it, right? He'll get on with it. So now if my high speed's leaking, right, I'll get a ton of tissue. I'll get a ton of tissue rolls, roll it up, tie it around where it's leaking on the high speed, just crack on. I don't care.
So my point then is, like, if you've encountered these problems, not that it's, a principal shouldn't really consider that a stress, though. That's an issue with the equipment in the practice. Would they never consider getting it fixed?
So this is the thing, right? What you have to understand from the principal's perspective, yes, obviously they need to try and get that fixed. But if that's an issue that's just come up, right? If that hand speed is leaking for like 2 months, that's an issue. Right?
Yeah, that's what I mean, though. So it's not like you left issues for lengthy periods of time without having them.
No, like that. If that's something that's continual going on, but yeah, that's happened before. Okay. But what I think most other, especially young associates, will do is, like, something will break, which happens, right? Something will break and they'll start complaining, and they'll go
cancel
to the
my list for the day.
Yeah, cancel my list for the day. Go to the manager. Oh, how can I work in these conditions? It's like, man up, just get on with it, right? Get tissue, wrap it around the handpiece, get on with it, right? Stop complaining, just deal with it, right? Sometimes, like, the high speed is like, if something's wrong with high speed and it's only spinning at like a third of the speed that it should be spinning, and I'm trying to do a crown pet, and I was just cracking on, right? And I didn't realize that it wasn't spinning fast enough, and I was wondering, why is it taking me so long to do these preps? But I'm like, okay, I'm just getting on with it. And then the principal's like, he tells me like a week later, Maz, this hand speed's broken, so just don't use that one, use this one. And I was like, that's what's wrong with it. So he's finally going to get it fixed, right? But that's the issue. See, young associates will complain, and my advice would be like, just crack on. Stop being a little fussy, annoying, moany associate and just get on with it. It's going to be really valuable, like a learning point for you going on, and it's going to improve you as a dentist, right? If you can work in difficult scenarios, it's going to improve your practice going on.
Yeah.
And inshallah, if you get a really good job, that principal, when something goes wrong in the practice, which is going to happen, some stuff breaks, right? They're going to appreciate the fact that they can rely on you to just crack on and not complain and just get on with it. That's a really big point. So that's the point, right, about owning a practice and having to deal with annoying associates, right, who are just going to complain. I've never been a principal. I've been an associate my whole career, but I've seen it. My uncle's a principal. He's been a principal for, I don't know, 15 years or something, maybe longer. My cousin's been a principal for 4 years. So I've seen it from both perspectives. And I think, you know, we talk about being a civilian in the inner circle, right? The point about being a civilian is that if you're going to take the leap to becoming a principal, understand the pros and cons of that situation. Understand that you're going to take a big leap. You're going to move from being an associate who works for themselves and at 5 o'clock leaves the practice. You're moving from being an associate to being a business owner with a huge number of responsibilities, right?
24/7 job.
Exactly. And understand the pros and cons. Don't take that leap and then complain, oh, it's so stressful being a principal and I'm barely surviving and all these nurses are giving me a headache and they keep leaving and I'm having such a high turnover and associates are complaining. Listen, yes, it's stressful. Deal with that stress. You made that leap. Don't be a civilian. Understand the pros and cons of that decision. Inshallah, the pro after 3 years of breaking even or making a loss, inshallah, you're going to start making a profit, and then you're going to be making a lot more profit than an associate. But it's going to take that 3 to 5 years of graft and barely breaking even before you reach that point. If you're not comfortable going through that stress, then stay as an associate and make a very good income. You know, we have associates in the inner circle who are doing 30K a month, GBP, as associates, right? And they're not doing anything crazy. I don't even think this guy's doing implants. He's just doing really high quality private dentistry, general dentistry. That's really high quality. And so, yeah, you can be a really high grossing associate without all the stresses. And 5 o'clock comes, you leave, you don't have to think about dentistry. You don't have to think about nurses. You don't have to think about your manager. You don't have to think about all the other annoying dentists working in the practice. You don't have to think about things breaking. You don't have to think about paying everyone at the end of the month. You just leave 5 o'clock, you get paid. So don't be a civilian. Understand the pros and cons of different situations. What do you think?
Yeah, definitely. I think it's one of those things that being a business owner is going to come with its own challenges. It's going to come with its own headaches. But like you say, it's a choice that's made by the individual who wants to do it. So if you're keen to do that and you want to have that extra, don't want to say you want the extra stress, but if you want that extra responsibility, if that's something you enjoy, if it's just business that you want to get into, because in all honesty, the dentistry business as a business itself can be lucrative, in my opinion, once it becomes a point where it's associate led. So personally, I think if I was to ever open up a practice, I would want to push as much or as quick as possible for it to become an associate led practice, because for me then, one, you've taken away 50% of your headache being treating patients, etc. You can focus on the business side of things, and that's where growth comes from. Anybody that I've seen that opens one practice and is able to take a back seat from that and make it an associate led practice then tends to go on to open up a second and then a third and then a fourth. They just copy paste the model.
Exactly. Bro, there was I'm going to ask you a question after this, but there was a really good practice I was working in Glasgow.
Right.
I'm sure you know the principal, and he had one of the best models and teams that I've ever worked at.
Okay.
The entire team, and I think he had about 6 practices at this point. I think he's got more now. But his entire team, all the nurses, staff, dentists at all the different practices, it felt like a family.
Yep.
And that was one of the best environments and teams that I've ever worked at. And what do you think it takes to develop an associate-led practice? Because this is something that I don't really have experience. I've worked at that one practice, but I don't know if I've ever really worked at another place where it's really aggressively associate-led successfully.
So I worked for a similar, I don't know if it was the same one, who knows, it might have been, but the one thing I realised about the owner was that they were actively involved in decision making, and they made themselves present as well. So like, as much as they maybe don't practice dentistry themselves, but they would be a part of each practice. Essentially, they would pop in, see how everybody's doing, is it anything you need, etc., and things like that. And this person in particular probably gave me my first opportunity at private dentistry, which I am grateful for, because I feel like it allowed me to get to where I am now. And it's through having the network within. Like, there's obviously going to be some more experienced dentists, and there's going to be some that are less experienced. The great thing was, like you've mentioned, the whole family sort of vibe. Everybody was bouncing off one another. If there was an issue, then, you know, so-and-so could help with this, so-and-so could help with this. And it collated everybody together. And I think having somebody at the top who, obviously being the owner itself, and having them sort of, it comes from the owner, I think. If you want a practice to be associate-led, it has to come from the owner, that they're actively invested in you as well. If they're showing that they are actively invested in you, you then feel like, okay, I've got the backing of so-and-so, and therefore you're likely to be more comfortable with what you do. Your performance will grow, and therefore everything, the practice itself, can grow as a whole. And if everybody's feeling the same way and things are growing in that sort of way, then success is around the corner.
Oh my bag, you know, that actually sounds exactly like what my cousin is doing in his practice in Manchester, mashallah. Building that really strong family environment where all the associates feel supported by each other. Right? There's one very young dentist that works there, right? And he feels very comfortable. And we made it very clear as more experienced associates that, listen, when I'm in the surgery next door, when we're working on the same days, you have any questions, you want some work check, come and ask me. No issue at all. And I think that's definitely a major point.
The other thing as well, see, when you have a practice that's run like that, I feel patients they feel more looked after. They feel as though, like, so it's not that you didn't know what you were doing, but what you've done for me is you've got somebody who's got more experience than you, okay, which is absolutely fine. Everybody is at various levels of experience, but you've ensured that I have got the creme de la creme, you could call it, of treatment.
Absolutely.
And therefore, patients are far more appreciative of that. And probably they'll turn around and they will thank you for it, because it's happened to myself before, where I've got a more experienced colleague and I'm like, look, what do you think? So-and-so, blah, blah, we have a set of discussion, and then they're like, patients turn around and say to you, I've never had that before. Or, that's never happened before, what was that? Can you explain that to me more? And you're more than happy to explain it to them. And you end up building that relationship with patients. Like we were speaking about earlier, what's so difficult to do under the NHS becomes so much more possible when you're in a private environment.
I think that's a really good point, right? For young dentists, I think we all go through that phase where we have the fear that when we bring a more experienced colleague in to look at certain treatment, we might feel as though the patient is thinking, oh, is he asking advice because he doesn't know what he's doing? But in actual fact, if you frame it correctly and you bring the other colleague in with confidence, right, it actually looks like, okay, this dentist that's treating me is very good, but he's just bringing in someone who has an extra level of experience in certain something, right? So one practice I worked at in Glasgow, right, the principal, amazing mentor, right? And he would say to me, Maz, and I was a really experienced associate when I was working for him, right? And he would say to me, Maz, if you need any advice, just bring me in and just say to the patient, hey, he does all the surgical stuff, so I'm just getting him a second opinion. That was a really good way to frame it.
I've got the exact same story.
But don't say this is XYZ, he's more experienced. Don't say that. Just say he does all the surgical stuff. That frames it in a really good way where the patient feels more supported, as you said. And they feel like, oh, you know, I'm getting all the different dentists with different expertise. So I feel consolidated that the treatment that I'm getting is the best. So different dentists are coming in, and the opinion that my first dentist has is being confirmed by the second dentist. That's what makes patients feel as though they're getting the best quality treatment.
You know what you've touched on there is actually something that I'm noticing. I know I've only been here for a short period of time, but see here, patients want to see the best person for each individual job. So, for example, the practice that I work within, we've got a surgeon, an endodontist, a periodontist, we've got a pediatric dentist, we've got all the different orthodontists, they're all in there. And the cool thing about the system here, I would say, is that everybody refers to one another. So let's say you refer for an endo, the endo will get done. Post and Co won't get done and the Crown won't get done. That comes back to you.
Brilliant. Yeah.
So I mean, it's a very nice way for the patients to be treated as well, because you explain to them, look, this is what's happened. For example, if a patient comes to see you in pain, you've extirpated the tooth, right? We're going to get you now booked in with so and so, so that you get the highest quality. Work done.
The best person for each job. The best person for the job.
And it's not that you can't do it. We can do it.
Yeah.
But for you to receive something which is going to be long lasting, for you to put your monies where it's worth, you know, give you the longest possible chance and the best possible chance of success. See so and so, see so and so. And it's a similar way that you've explained it. I mean, I remember back in the UK, difficult extractions that happens to us all.
Yeah, of course.
One tooth, a root that's stuck, you just can't get out. I called in the implant dentist who did all the surgical stuff in the practice, and just like that, he's like, so just try this next time, you know, just tweak it from here. Since then, like, I swear, it's like you pick up hints and tips from everybody, and you shouldn't be afraid to continue learning. Like, life is a journey. Dentistry is a journey. So, I mean, you should never, I personally feel like you should never be ashamed of not being able to produce the best possible work, because you are on your own personal journey, professionally as well as personally. So